May is Mental Health Awareness Month, and it's a time when we especially honor those who provide mental health care services to our families and our neighbors every day. And we're going to hear from four members of AFSCME who are mental health care providers, like the other 64,000 members of AFSCME who are counselors and caseworkers and care providers in this field. And they all bring passion to their work, they bring skills to their jobs every day, and they bring their voices to advocating for those they serve. What drew you to the work that you do, and what keeps you going?
I've always knew I had something in me where it came to helping other people. After 15 years, it is an eye-opening experience still.
Through my own struggles with mental health, some of the struggles with mental health in members of my family, and then looking out at our greater community, I was like, wow, there's a lot of work to be done here. A lot of mental health workers come to this field from their own lived experience, and that's the beauty that we bring is that personal empathy, that personal self.
How does having coworkers and a team contribute to keeping you going in the work?
We need our co-workers to have our backs. Me, myself, I've had 2 meniscus tear, 1 concussion. And I know on one occasion, had it not been for my co-workers, it could have been worse. So we do have to depend on our co-workers and work together.
Working in mental health, it is a really hard job, right? Nobody's going to understand better what you're going through than somebody who is also doing it right beside you, right? And so going to them and asking for some advice or support, it's really helpful just to have those individuals there to lean on.
I'm going to move us on to talk about some of the challenges that you're seeing in what's going on in our country and in your community in terms of the mental health crisis.
As an addictions counselor, I certainly see firsthand the impact that the opioid crisis is certainly having. 40% of our adult residential treatment beds have had to close since COVID in Oregon, and 60% of our adolescent treatment. Well, these are crucial, crucial services, and we have lost so many of them due to the pandemic and staffing shortages.
All across Appalachia, but definitely southeastern Ohio, there are issues with poverty, and there's issues with alcohol and drug abuse and food insecurity and all of these other things that affect kids, right? We are still seeing the effects that this pandemic has caused in our children.
You can't mention the client without mentioning the staff. There's no such thing as separatism there. If you mention the needs of a client,
Mm-hmm.
you must mention the needs of a staff.
I am going to speak on the mental health of the mental health employees. Over the past, I would say 3 years since COVID, the mental health of the employees has been diminished. I see people breaking down and crying. I sometimes have to have people go sit in my office and take a moment.
Do you want to say anything about how you're responding through the union to try to address some of the challenges?
The 3 O's: organize, organize, organize. That's what we're going to do.
Yes,
When
indeed.
the new employee orientation, as soon as they walk in the door and you sign them up, we went up there for lobby day and got in their face and let them know we need our money. State employees need our money now. Ask me, stand strong. We come together and we organize, organize, organize.
Two workers started asking the real questions like, what are we going to do about these caseloads? What are we going to do about productivity? And they were met with some blank faces. So we contacted AFSCME and we started organizing and just talking to all of our coworkers. And eventually we got to our election and we won our election.
What would you say to someone who's facing fear about organizing a union, either their own fear or their coworkers' fear, to give them some strength to help them form a union?
You're not alone. It's okay to be scared. These are really hard changes to make, and it's unlikely that change is going to happen without us making a change ourselves. We do have the power to make those changes, even if it seems tiring, even if it seems like an uphill battle, anything is possible if we all work together.
Well, that's a great transition for me to say that we do have a network for mental health care providers within our union, which is 1.4 million providers of public service, but within that, we have 64,000 or more mental health care providers. And we have the network called United We Heal, which is part of our AFSCME.org website. And you can learn more if you are a current AFSCME member who's a provider of behavioral health or mental health care, or if you are a potential member, somebody who works in the field and has not yet formed a union on the job. You can find us on AFSCME.org at United We Heal. And we have a campaign called Staff the Front Lines, which is to respond to the staffing crisis that exists not only in mental health care, but across public services in the country right now. Everywhere, AFSCME members are struggling with mandatory overtime, with high caseloads, being stretched to the breaking point, and we need to resolve that staffing crisis across the public sector and public services, especially in mental health care, where there's so much at stake. So let me thank all of the panelists for joining us today, but also for the incredible work that you do, for the skills you bring to the job every day, for the voices you bring in advocating for your clients, for our family members and our neighbors, and for your passion for the work that you do, because it shows up in everything you say, and it's really powerful.